Hello, everyone. Welcome to Medical Queens Got Talent. It is an online portal founded by Dr. Jaya Daptardar, who is a Ayurveda and holistic wellness expert. We offer health and wellness talks by healthcare experts. Purpose is to raise awareness and impact the health and wellness of all people around the world. Our goal is to help educate, provide resources and information to overcome these challenges. These talks are for educational purposes only. I am Dr. Rachna Valvani. I am originally from India. I did my medical school from Jabalpur, followed by a residency training in respiratory medicine from Indore. In 2016, I moved to the United States to do a residency in internal medicine, followed by a fellowship training in geriatric medicine. I currently work as an academic internist geriatrician at Bronx Care Health System. I'm going to introduce you all to the concept of osteoporosis, which is a very important geriatric syndrome. It's a health-related condition that can lead to more severe morbid conditions as we age. What is osteoporosis? Osteoporosis is derived from two words. Osteon means bone and porosis means thinning. It is a condition in which the infrastructure of the bones becomes thin and weaken. And what does it lead to? It leads to a higher risk of fracture, which can occur even from minimal stresses. Why do bones become weak? Bones depend on calcium, vitamin D, other chemicals, and minerals to keep them strong. Bones, like any other living tissue, grow as a response to physical stress being put on them. The hardness or the density of the bones requires a good diet, sunlight exposure, and exercise in order to stay strong and not break. I want to tell you about bone development. So bones build mass beginning at birth. Now, as we grow older and reach the age of 30 years, we achieve our peak bone mass. Thereafter, there is slow loss or decline in bone mass, which is a natural aging phenomenon. In the beginning, it would decline by 1 to 1.5% per year. This process becomes hastened or accelerated soon after menopause. In the first 5 years, it declines at the rate of 3 to 5%. Bones are living tissues. Bones have two kinds of main cells called osteoblasts, which are building new bones. They can be analogous to the workman who puts cement or bone structure to build new bones. And then on the other hand, there are osteoclasts, which are the repairmen. They're responsible to remove old or damaged bone. During normal, healthy people, there is a good balance between the osteoblastic as well as the osteoclastic activity. This leads to regeneration of bone, and it's called bone remodeling. When this process gets hampered due to age or other risk factors, it leads to demineralization, ultimately causing osteoporosis or fragility and thinning of the bone. This is a complex scientific diagram to show normal bone remodeling. In this, there's a resting stage, and whenever there's a stressor to the bone, the osteoclastic activity becomes stronger. It leads to like a hole in the bone, which triggers the osteoblast or the repairman cells to reverse that process, ultimately leading to bone formation and repair of that damage. This process is again called as bone remodeling. And why is it important to study osteoporosis? There are many reasons. It's a common metabolic bone disorder affecting all older adults. It is preventable and treatable. If not treated, it can cause fractures, chronic pain, decreased mobility, loss of independence and function, ultimately leading to institutionalization and increased mortality. Of course, it's a global problem, but I like to highlight the importance of this problem in America. 54 million Americans over the age of 50 years either already have or at risk of osteoporosis. This is data from National Osteoporosis Foundation. 24 million others have osteopenia or low bone mass. It affects more women than men in the ratio of 80% to 20%. It affects people of all ethnicities. In 2005, there were more than 2 million fractures in the United States, and this number is expected to rise to more than 3 million by the year 2025. Importantly, 1 in 2 postmenopausal women and 1 in 5 men over the age of 50 years old will have an osteoporotic fracture in their remaining lifetime. Mortality risk is estimated to increase 20% in older adults in the year after a hip fracture. Weak bones cause the spine to collapse, resulting in a stunting in the height and also a loss of confidence. Hip fractures account for 300,000 hospitalizations annually. People who break a bone of the hip joint might not recover for months or even years. 1 in 5 people with a hip fracture might end up in a nursing home within a year, and they may never be able to walk again. Now, what leads to osteoporosis? So there are multiple risk factors, some that we can change, some we cannot change. So the ones that we cannot change are called non-modifiable risk factors. These are age, gender, postmenopausal status, family history, race, vitamin D, genetics. A smaller frame, less than 127 pounds, is known to lead to a higher osteoporosis risk. Hyperparathyroidism, some cancers, organ development, and some necessary medications like steroids, anti-seizure medicines, anticoagulants, levothyroxine, chemotherapeutic drugs, and diuretics. Now, there are some additional risk factors. There are diseases that are often treated with steroids or glucocorticoids. People may have asthma, bursitis, Crohn's disease, chronic active hepatitis, dermatitis, glaucoma, SLE, multiple sclerosis, osteoarthritis, psoriasis, rheumatoid arthritis. Now, I'm not saying don't use glucocorticoids or steroids when indicated, but we have to be mindful and judicious about the proper dosage and the long-term use. Now, some of the modifiable risk factors, the ones that we have an opportunity to change, is diet, inadequate calcium and vitamin D, too much or too little protein. There are a lot of diets that are against our conventional health system, like the keto diet, the vegan diet. Now, I'm not a dietitian or a nutritional expert, but in excess of anything, even if it's protein, could be hazardous to our bone health. And there are a lot of bone damaging medications, like one I already told you is steroids, but there are others like proton pump inhibitors or anti-acid medicines. They could damage bone long term. Unhealthy lifestyle choices, drinking excessive alcohol, more than 2 drinks per day over a period of a lifetime, is an important risk factor. And data suggests any kind of smoking in any amount or limit is definitely an important risk factor. Too little exercise or sedentary lifestyle, and under eating. A woman's hip fracture risk equals her combined risk of breast, uterine, and ovarian cancer. And I have national data to support that. The Centers for Disease Control and Prevention published this data in which the annual occurrence of fracture was 2 million compared to breast cancer, heart attacks, and strokes. So osteoporosis is a serious health problem. 70% of people over the age of 65 with osteoporosis have never been screened and don't even know they have osteoporosis. Now, before I go on to more details, I'd like to introduce you to a concept called osteopenia. Osteopenia means loss or decrease of bone mineral density, which ultimately leads to osteoporosis. Now, what is bone mineral density? It is the measurement of levels of the minerals in the bone. What does it indicate? It indicates strength and density of the bone. And when bone mineral density is very low compared to normal, it is known as osteoporosis. Now, the World Health Organization defines osteoporosis as a bone mineral density of at least 2 standard deviations below the young adult reference. It is measured with a statistical unit called T-score. Another clinical definition by the WHO is that if there's a presence of a fracture of the spine, the proximal humerus, the hip, as well as the wrists or the forearm in a patient with existing osteopenia, automatically makes a person fall under osteoporosis. Now, how do we diagnose osteoporosis? There's a imaging test called DEXA scan or dual X-ray absorptiometry. It's like a X-ray machine without the radiation. It is indicated for all women more than 65 years of age as a screening and a diagnostic measure, or younger patients with the other risk factors that I told you before. Now, patients typically will bring their bone scan or DEXA scan results. And in terms of the T-scores, if the T-score lies anywhere from -1 to +1, that's a normal bone density. If the T-score lies between -1 to -2.5, it means low bone density or osteopenia. Any score beyond the range of -2.5 is called osteoporosis. So even though you may have a low bone density, you may not have an increased risk fracture. I had a patient in clinic last week who brought in a DEXA scan result and her T-score was -5.4. Now, she was a very well-aware and educated patient, 78 years of age, and she wanted to know what lies ahead. So what did I do for her? I calculated the FRAX score. What is a FRAX score? The FRAX tool has been developed by the World Health Organization to evaluate fracture risk of patients. It is based on individual patient models that integrate the risks associated with clinical risk factors as well as the bone mineral density at the femoral neck. This model has been developed from studying population cohorts across continents, all including Europe, North America, Asia, and Australia. The FRAX algorithms give the 10-year probability of fracture, and the output is a 10-year probability of hip fracture, as well as a 10-year probability of a major osteoporotic fracture at all the known existing common sites, which is the spine, the wrists, the hip, as well as the shoulder. I have provided a link for the FRAX score. A typical FRAX score would look like this, wherein it's a questionnaire which would include all the risk factors, your patient demographics, and ultimately would give the 10-year major probability of a fracture. In this case, the example shows like a 14% risk of a major osteoporotic fracture and 1.57% of the hip fracture. This is just an example, and I would like you to take professional help if you need to calculate this. Now, what can we do? We should be taking recommended amount of calcium and vitamin D, do regular weight-bearing exercises, and avoid smoking and excessive alcohol. What is the recommended calcium requirements for patients or people more than 50 years of age? 1,200 milligram is the goal. Now, a lot of times, people would say, oh, I drink milk and I take enough calcium. But there are other resources and other sources of calcium, like broccoli, like millets, like bananas. So people who cannot tolerate milk don't have to worry that it's the only source of calcium that they can derive. The other important modifiable risk factor that we discussed was exercise and bone health. Lack of physical activity results in a bone mass because exercise or physical stimulation increases the bone mass. Static weight-bearing exercises can reduce any decline in bone mass and actually improve the bone remodeling even in patients over the age of 70 years. High-impact exercise in early years increases the bone mass rapidly. Balance and strengthening exercises will decrease fall risks like yoga and Tai Chi. Now, hip fracture prevention. So how do younger adults fall? So in a younger person, a fall occurs during moderate or brisk walking. They have enough forward momentum so that the points of impact are the hands and the knees, and they fall ahead. In compared to our older adults who already have a hunched spine or have osteoarthritis of the knees or a problem with the ankle, they probably might be using a cane or a walker. They tend to collapse downwards, often landing directly on the hip or the spine. A fall occurring while standing or walking slowly has little forward momentum. Therefore, the principal impact would be near the hip. Now, of course, there is treatment for all ailments, and even despite following all preventative measures, if one has osteoporosis, then there is indications for treatment. So those with a clinical or asymptomatic hip or vertebral fracture, those with a T-score of less than equal to -2.5 at the hip, spine, or femoral neck, like my patient who brought in a report of -5.4, which is a major risk for a fracture and definitely an indication for pharmacologic treatment. Those with osteopenia and a 10-year probability of more than equal to 20% of a major osteoporotic fracture or more than 3% of a hip fracture. What should I do first? There are three major things you can do. Talk to your doctor or provider about a bone density test or a DEXA scan. You can talk to a physical therapist, a trainer about your activity level, and enroll in an exercise program to combat osteoporosis. Now, mind it, not everybody has the capacity or the capability to see a physical therapist, but this is pertaining to people who are older than 50 years and there is a high risk of imbalance. So I suggest that you should enroll yourself in a professional program and then work on your muscles and bones. And lastly, talk to a dietitian or a nutritionist or an expert in Ayurveda or the alternative sciences to make sure your diet is nutritious, providing your bones with enough calcium and is balanced correctly. Now, this is a list of all the FDA-approved osteoporosis medications, and the first line treatment is the bisphosphonates. Now, I am not going to go into details about these, and I would strongly encourage all of you to talk to your providers, and if there is an indication, then take professional and correct help to initiate any kind of treatment. So lastly, I would reiterate that osteoporosis is a major risk factor for fractures, and it's a very preventable syndrome. We should all pledge to take adequate calcium and vitamin D, do weight-bearing exercises, and start as soon or as late as the 70s. Try to modify the risk factors that we can. It is very treatable. Bone mineral density establishes the diagnosis. Screening is recommended for all postmenopausal women more than 65 years of age. So if your doctor or your provider has not initiated this conversation, I would encourage you to please open the concept and ask about your bone health and what can you do. FracScore is an online clinical tool, and it predicts the 10-year probability of one having a major osteoporotic fracture, and bisphosphonates are first-line therapy. Thank you and have a good day.